Feel sorry for male nurses on the unit. They must be really depressed after failing out of medical school. Hashtag MERS, hashtag where's my purse. Well, I'm done.
Whoa, look at this. These nurses are so lucky to be working with us. Hashtag privileged, hashtag doctor's life, hashtag super beings. Well, I think they're privileged to be working with us.
Yeah, obviously. She makes a good nurse because she is so good at taking orders. Hashtag clueless, hashtag ditz, hashtag professional bum wiper, hashtag go get my coffee.
Pharmacists are like doctors. They are just less talented, make less money, and less respected. Hashtag sad life. Well, we go to school for 4 years, my doctor!
Hey SLP, did I st-da-da-da? Hashtag t-t-day junior. That's good, that's funny.
Being a pharmacist is not too bad, unless you are being robbed at gunpoint by a drug addict demanding for morphine. Hashtag no thank you. Hashtag worst job ever. Well, it's probably true.
Why is there a nurse talking to me about my health? Isn't there poop to be cleaned somewhere? Hashtag track that poop.
Why do I need to see an occupational therapist? I'm not looking for a job. Hashtag confused. Hashtag waste of time. It's not even funny. OT must stand for hashtag obviously terrible.
Deal with you after. The only reason women become nurses is to marry a doctor. Hashtag doctor's life.
What's the deal with hashtag speech language pathologists? All they do is play with kids all day and get paid for it. Hashtag get a real job? I don't even like kids.
Why do you have to get an OT degree just to do crafts? Hashtag Pinterest degree. Hashtag DIY fail.
What? Lab techs go to school for 4 years and no one knows what we do? Hashtag MLS problems. Agreed. I swear my patients will bleed out due to all these blood draws. How many pokes does it take, lab rat? Who is that? Hemolyzed sample, tube labeled incorrectly. The lab must have done the test wrong. Hashtag recollection, hashtag minion issues, hashtag no one understands, hashtag long day. You guys are
Quiet down, everyone. I've initiated this meeting today to address the concerns and about the misunderstandings of our professions. As you know, there have been a lot of mean tweets going around this unit about one another.
Yeah, I super hot fire. I'm not just a drug dealer.
Yeah, and I don't just follow doctor's orders.
Okay, I understand everyone is clearly a little upset right now. Now we need to get organized and have this meeting like true professionals.
I have another meeting in 10 minutes, so we better make this fast.
Can anyone be the timekeeper?
Can I be a timekeeper, please?
Oh, Long, I see you came prepared. Okay, now we just need a volunteer to take some notes.
I can record some things.
Oh, Amber, I see you also came prepared. Okay, so to get started, let's go around the room and introduce ourselves and state our professions. I will start. My name is Kate, and I am an RN.
My name is Long and I'm a pharmacist.
Oh, I didn't see you there. My name is Steven and I'm a nurse.
My name is Jenny and I'm a speech language pathologist. I'm Sylvia and I'm a laboratory technologist.
My name is Amber and I'm an occupational therapist.
My name is Jory and I'm a nurse.
Our main goal of today's meeting is to learn, understand, and respect each other's roles. We are ultimately a team and need to work well together to provide the best possible care for our patients. Remember, this is a safe and non-judgmental place. So to break the ice, how about we start by addressing those mean tweets?
Well, I'm really upset and frustrated that many people still think nurses just follow doctors' orders and clean patients. We do so much more than that. We constantly assess our patients and make sure they're provided with safe, competent care. Steven, you know the rest, buddy.
We make sure the medications they are prescribed are for the right reason and monitor the patient to see if they exhibit any side effects. We can also be a useful resource for you to be updated on how your patients are doing, since we spend the most time with them at the bedside.
Wow, Stephen. I didn't realize how important you were. I'm going to come talk to you more often.
I feel bad for just assuming that all you do is follow doctor's orders and clean patients. Thanks for clarifying your role.
Yes, thank you for sharing with us. Does anyone else have anything else to share?
Yeah, I don't know why people think pharmacists are not as talented. Like, we have to make sure the medications are safe, manageable, indicated, and effective for patients. Do people even know how many drugs that we have to know?
There's aspirin, adrenaline, and also aminophylline, amphetamine, adenosine, augmentin, and rifampicin, amoxicillin, penicillin, heparin, and warfarin, and estrogen, progestogen, and canesten, and chloroquine. There's bendraflumethiazide, and also cyclophosphamide, and metoclopramide, acetazolamide, tropicamide, loperamide, amiloride, and cyclazine, and fusamide.
Wow, how did you do that?
You must have an amazing memory.
Thanks.
Well, I know some of you think that all I do is find people jobs, but that's not true. We do so much more than that. Occupational therapy has such a wide scope of practice. We do things like teach new dressing techniques, do cognitive assessments, we even assess range of motion and do discharge planning.
Wow, that's awesome. I will definitely seek your advice before discharging my patient into the community, just to make sure they're ready to go home.
Thanks for sharing!
Oh, that was kind of weird, but anyways, why do people just think that male nurses failed out of medical school? They have a different role in the healthcare setting and both contribute greatly to the patient's health and well-being.
Good point, Joy. Thanks for clarifying with us.
Also, women don't just become nurses to marry doctors. This isn't Grey's Anatomy.
You've been really quiet over there, Sylvia. Is there anything that you'll like to add?
Well, actually, there is. Lab techs have the ability to collect blood, but that isn't the only thing we do. There's many other processes such as quality control, explaining test procedures and collection procedures, and clarifying and troubleshooting any analyzers that might not be working to ensure that patient testing is done appropriately and in a timely manner.
Oh wow, you guys sure do sound like you have a busy day. It's great to know what actually goes on in the lab.
Okay, 30 seconds left.
Okay, I have one more thing to say. People really underestimate the scope of speech-language pathology. We have to learn all the anatomy and physiology of the face, neck, and respiratory system. I bet you guys didn't even know that SLPs do swallowing assessments. We also work on communication and regaining basic skills in those who have lost theirs.
Sorry that I sent me tweets about you. Your job sounds so complicated, if not about stuttering.
Wow, patients must really appreciate everything you do for them.
It's debrief time.
Thanks everyone for sharing your thoughts and feelings from today. Let's go over one new thing that we've all learned today.
Well, today I learned that pharmacists can be a great resource if I'm ever unsure if a medication is incompatible.
Thanks. I actually think nurses are the best because they help us monitor patients so that we could do our job. Without you guys, we are nothing.
And I didn't realize how similar OT and SLP are. I'll definitely be turning to you a lot more often, Jen.
That would be great.
Why do you guys think it is important that we have this meeting today?
Well, patient care is everyone's #1 goal. And if we don't know what each other health profession does, how are we able to provide the best possible competent care to our patients?
Exactly. We need to be able to properly communicate with each other so that we can form an effective, efficient, and coherent team so that we have the best patient care possible.
Absolutely.
Guys, those are some very good points. How can we ensure that we keep in touch and learn about one another's roles?
Oh, I heard of this thing called rapid rounds. They give us the chance to talk about our patients and collaborate.
I love that idea!
Yeah, so why don't we try to meet once a week and talk about our patients? That seems good.
Sounds good!
Great. Okay team, so earlier on today, we were all separate and angry at the beginning, all spread apart from each other. Here was the football field goal and we were too far. But at the end, we came down to it. And after we realized that patient-centered care was important to all of us, we came closer, and then the goal line came closer to us. And then therefore we realized that we were able to solve these conflicts together as a team. And touchdown. But to avoid the conflict and get straight to the goal, what we worked on and what we need to work on is avoid yelling at each other. And if a conflict arises, instead of tweeting about it, go talk about it in person.
Wow, Jory, that was a really great breakdown. I'm really glad I got to participate in this conversation today.
I agree with Jenny. I'm really glad we got together for this meeting today. We were able to accomplish our main goal and work really well as a team. Let's plan a meetup next week and talk about implementing those rapid rounds and discussing our patients' care plans.
Sounds good!
Excellent job.
This course has been a benefit to each of us. As we all know, the healthcare system isn't perfect, but it is important for healthcare professionals to work together to reach a common goal of patient-centered care. Even though we made some jokes and had some laughs, we hope these roles have now been ingrained in your mind and that you remember why communication, collaboration, role clarification, and reflection need to be cornerstones of your interactions with one another and the people we are caring for.
Everything is awesome. Everything's cool when you're part of a team. Everything is awesome.